My name is David Dingli. I'm a consultant in the Division of Hematology and a professor of medicine at the Mayo School of Graduate Education. And I'd like to discuss with you today a report that will be published in the current issue of the Mayo Clinic Proceedings, where we describe a unique patient with two forms of hereditary amyloidosis. The title of our manuscript is A Patient with Hereditary ATTR and the Novel Gelsolin Alanine 578Pro Amyloidosis. This report is interesting for a number of reasons. When we saw this patient initially, he was referred to us as a possible hereditary TTR amyloidosis for consideration of liver and heart transplantation. Our evaluation not only confirmed that the patient indeed had hereditary TTR amyloidosis, but surprisingly had a second form of amyloidosis that was also proven by biopsy and sequencing by mass spectrometry of the tissue and mutation analysis of the gelsolin gene. It has been known for some time that a patient with amyloidosis may have more than one, if you will, competing cause of the amyloid. For example, a patient can have a monoclonal gammopathy that might suggest the patient has primary amyloidosis, when in truth the patient has TTR or some other form of amyloidosis. But to our knowledge, this is the first reported case ever where the patient has two independent mutations that can lead to two amyloidosis syndromes. And this is quite important because therapy for the different types of amyloidosis differs. The TTR mutation that we found is well known and an established amyloidogenic type. The gelsolin mutation that we found is novel, has not been reported before. We confirmed it both by sequencing the protein as well as the gene. But whether it is amyloidogenic or not has not been established. So what we did dynamic simulations in silico to determine how this mutation would alter the amyloidogenic potential of the gelsolin gene. And we believe that this is indeed a cause of amyloidosis as well. Interestingly, this patient had the two types of amyloidosis distributed differently in his tissues. The TTR amyloidosis was, as expected, found in the heart, but the gelsolin mutation was solely found in the gastrointestinal tract and abdominal fat. For us, the learning points from this case are that we need to be very vigilant and we need to make sure that we understand the actual disease that the patient presents with, and that the patient can have more than one type of amyloid at the same time. Finding one type does not exclude the possibility of a second type. And this becomes quite important because therapy for amyloidosis is not exactly benign, and it can require transplantation, and of course we want to do the right thing for the right patient. It also tells us that there's a lot that we do not understand about this disease. As you will read in the paper, the main reason why the second type of amyloidosis was found was because we did a fat aspirate and a gastrointestinal evaluation, and there we found the second type of amyloidosis. So there's more to learn about this fascinating disease. Thank you for your attention.
We hope you found this presentation from the content of Mayo Clinic Proceedings valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.